In this week's MoCo Minute, a new nonprofit based in Silver Spring is working to make healthcare more personal and practical. The Center for Person Centered Care has officially launched, offering free tools to help patients, providers, and insurers make healthcare decisions that better reflect people's real lives. And joining us now is Dr. Cynthia Overton, Executive Director for the Center for Person Centered Care. Thank you so much, Cynthia, for being here.
Oh, thank you so much for having me, Shanika.
Yeah, and everyone knows how important healthcare is. And the fact that you are opening up a nonprofit to help people, it just says a lot, especially in the Montgomery County community. So tell us what person-centered care is and why is it so important?
Sure. So person-centered care is an approach to healthcare that really brings together the clinical expertise that your provider has with the personal expertise that you have, right? So you know your life, you know what you need, you know what your goals are, you know the context in which you have to carry out a healthcare plan. And so the idea is to really bring together that clinical expertise with your personal expertise to create healthcare plans that work for you. That's why I say healthcare for people who live in the real world, not in a medical chart. And just think of it like this. Think about how when you fly, right? You expect your pilot to have the technical expertise to fly the plane, right?
Yeah.
But you also want the pilot to know where to go. You need them to know the weather conditions, the context in which they're flying. You need to understand them to understand the airspace. And so it's not that different when we think about healthcare. We need our doctors to really understand the conditions, your conditions that are needed to create healthcare plans that work for you.
And why did you decide to launch the Center for Person-Centered Care?
So, Shanika, there's so much important work going on around person-centered care. A lot of it really focuses on research, which of course we need, but I really saw an opportunity to help people understand and benefit from that research. So I think that knowledge translation in the healthcare field is incredibly important. So I draw on principles from the Picker Institute, which developed these principles for person-centered care. But there are also other organizations. There's an organization called Plaintree that really helps organizations adopt a person-centered care approach. But I really wanted to create a resource center that was specifically for patients, providers, and payers, so like your health insurance companies, to help each of those groups really move forward in a way in alignment to advance person-centered care.
And if, someone has, a medical condition and they don't know where to start, what do you do?
Sure.
Because, we're talking, okay, so I mentioned one case, right? Someone with a medical condition. But how about, I'd say, the elderly, where when you get to a certain age and you need extra care.
Right.
Where do you go and how would your center help them?
Right. Well, speaking of in terms of the elderly, both of my parents are aging, and so this is something that is really, really important to me. It's also important to be able to understand as, a caregiver, how can you support someone? And unfortunately, it can be very challenging to find resources. And so, I'd say come on over to the Center for Person-Centered Care online to identify some of the resources that we have, whether it be caring for a loved one experiencing a serious illness or a medical crisis. We've got a resource on how to prepare for a medical appointment. We've got all sorts of resources to really help people navigate the healthcare system. I kind of came to this, though, from personal experience, right? So almost 30 years ago, when I was in my 20s, I was diagnosed with something called an arterial venous malformation wrapped up inside of my spinal cord, and it hemorrhaged. We didn't know about this, Shanika, until this thing hemorrhaged. At the time I was young, I was, my priorities were elsewhere. They weren't necessarily focused on healthcare, right?
Of course, yeah.
So, I would go to the doctors to really try to understand what was going on. But, Shanika, I wasn't showing up with, something to write with. I wasn't asking the right questions. I wasn't tracking my symptoms like I should have been. Had I been more informed, I may have done things a little bit more quickly, but I just did not have the information that I needed. With my health experience, I was very fortunate in terms of having parents who were not doctors. They didn't have a medical background, but they understood how to navigate systems, and they knew to be persistent and not to give up. So we went through this whole ordeal in terms of negotiating with the insurance company. So we've got resources on how to, navigate insurance companies. We had to find a doctor that actually had the skills to perform the surgery, because we're dealing with the spinal cord here, right? Very delicate. So I come to this from personal experience, and as somebody who has gone from being having no health challenges to somebody who then experienced this, was paralyzed, a wheelchair user for a while, have gone through physical therapy, has, even navigated identity, right, when it comes to changes in function, right? I did not know what it meant to be disabled until I was literally in a wheelchair, and the doctor asked me if I wanted paperwork for disability parking placard. And even then I was like, who's this for? I had no idea. So we even have a resource on changes in functioning and how you kind of navigate that as you go through the healthcare system.
Yeah, and that could be so much for someone. Like you said, you didn't prioritize your health at 20s. And one thing you did mention, you said back in my 20s when I was it. And respectfully, you are still it. I just wanted to say that. No, but all seriousness, a lot of people, they really need these resources. They need to know how to navigate when they find out, some sort of health scare, and what doctors to look for. Is certain things. As I get older, I hear certain things, and I'm like, whoa, I didn't know that this even existed. Yeah. Now I have to go check. Get a checkup to see, if I'm okay. So yeah, we really need resources like this.
And I do want to just say one other thing, as we enter the season for these elections coming up, one of the sheets that we have describes questions that you can ask candidates about the healthcare system and what they plan to do to help make healthcare, more affordable and more accessible for everyone. A lot of people just really think about healthcare, at least this is how I was. And I just thought about the patient, I thought about the doctor, but our policymakers really have a lot to do with shaping the experiences that we have in the healthcare system. And I think it's very important to have these conversations with them.
Very, so important. We know, that's key. And so I'm sure a lot of healthcare centers leave that part out, and I see that you have that in there. So thanks for that. And we've already talked about how this could better patients' lives, and these are free resources. What about the long-term impact for this center? I mean, what do you see? What do you envision?
So for me, Shanika, a win would be for people being able to go to the website, look at the free resources that we have, use them as a guide to start really thinking about how to navigate their healthcare experiences, and feel empowered to really speak up, ask questions, let doctors know what their needs are, what their goals are, what the environment is. Because you know what? You have to be able to execute a plan in order for it to work. And so, think about your doctors want you to be successful, but they don't know the ins and outs of your life. It's up to you to bring that information to them. So for me, a serious win would be for people to be able to go to the resource center, download the resources and use them, and adopt them within their institutions, healthcare organizations, hospitals, doctors' offices. These have wide uses across the board.
Wow, I love it. I love that it's a link between healthcare providers, the whole system, patients, everyone. It's just all like a community thing where you can just find those links. So Thank you so much. We have Dr. Cynthia, Overton, Executive Director of the Center for Person-Centered Care. Just thank you so much for being here.
Oh, thank you for having me. And I would encourage people to go to person-centeredcare.org for the resources.
Thank you.
Thank you.